Now to the fight against COVID-19, nearly 100,000 doses of the monoclonal antibody therapy has been administered in Florida. And Governor Ron DeSantis has been heavily promoting the treatment and credits it for keeping people out of the hospitals. Well, today the governor was expressing frustration with the federal government over a new policy regarding the treatment. Fox 13's Justin Matthews joins us now live in Tampa. So Justin, what's changing and what does it mean for Florida?
Hey, Chris, the U.S. Department of Health and Human Services is now going to be controlling the distribution of the doses. So Governor Ron DeSantis says that now Florida may not be getting enough and patients may suffer.
You've got to have early treatment be part of your approach, and so we're going to make sure we continue to do that here in the state of Florida.
Governor Ron DeSantis in Fort Lauderdale Thursday, speaking on the importance of monoclonal antibodies to help treat people in the early stages of COVID-19. White House officials say the state of Florida has been getting the most doses of the treatment, with Texas in a close second. But now the Department of Health and Human Services is taking over the distribution, whereas before states could order monoclonal antibody treatments directly from drug companies.
We are very, very concerned with the Biden administration and the HHS's recent abrupt, sudden announcement that they are going to dramatically cut the number of monoclonal antibodies that are going to be sent to the state of Florida.
Governor DeSantis says this is going to cause obstacles.
They're saying that all of the reduced amount will go to the state, and we're responsible not only for sourcing our sites, which we're happy to do, but any infusion center, any provider, any hospital will have to come through the state. And to just spring this on us starting next week, we're going to have to do that. There's going to be a huge disruption, and patients are going to suffer.
But White House officials say the federal government's distribution plan helps ensure more states get the amount of treatments they need.
We're going to work like hell to make sure that we can overcome the obstacles that HHS and the Biden administration are putting in us.
President Biden said he wanted to increase the amount of treatments to states by more than 50% in September. According to HHS, the president met that goal. And HHS says the agency distributed about 100,000 doses weekly in July and August, and last week they distributed 177,000. Chris?
And hospitalizations are trending downward in Florida during this time. Thank you, Justin.